Welcome to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. Note, the views on the podcast represent those of my guest and I.
Scene script introduction, general principles, pharmacodynamics, effects of drugs on an organism, pharmacokinetics, absorption, distribution, metabolism and excretion of drugs, drugs which act independently of receptors, antacids, base moiety neutralizes acids, osmotic agents, certain diuretics, for example mannitol, cathartics, for example methylcellulose, anesthetics, unknown mechanism of action but potency correlates with lipid solubility. Most receptors are proteins, many with carbohydrate residues attached. Binding of drug to receptor may involve ionic, covalent, hydrogen or van der Waals bonds. Agonists, drugs which bind to receptors and stimulate them. Antagonists, drugs which decrease or block the effect of an agonist. They do not stimulate the receptors. Competitive antagonists reversibly binds to the receptor and prevents binding of the agonist, antagonist and agonist vying for the same receptor. High concentration of the antagonist can overcome the effect of an agonist. Irreversible antagonists usually binds to the receptor in an irreversible way and prevents any agonist action. Following administration of an irreversible antagonist, high concentrations of agonist cannot completely reverse the antagonist effects. Duration of action depends largely on the irreversible antagonist. Potency, activity of a drug compared to a reference standard, depends on the drug's ability to reach the receptors and its affinity for binding to the receptors. Efficacy, maximal effect produced by a drug. Note, a drug may have a greater potency but less efficacy than another drug. Dose-response curves, ED50. Dose of drug which produces half maximal response, that is, observed effect seen in 50% of patients. Used as a measure of potency, the lower ED50, the more potent the drug. TD50, minimum dose which produces a specific toxic effect in 50% of individuals or animals. LD50, minimum dose which kills 50% animals. Therapeutic index, ratio of the dose of the drug required to produce a toxic effect to the dose needed for a therapeutic effect. Used as an indication of drug safety, expressed as what? Narrow therapeutic index, relatively high incidence of side effects at usual doses, narrow range for therapeutic and toxic doses. Wide therapeutic index, relatively low incidence of side effects at usual doses. Permeability. Lipid solubility correlates with the ability of a drug to cross cell membranes. Weak acids and bases are more lipid-soluble in the non-ionized state. Ionization, charged water-soluble molecules are excluded from crossing many barriers, for example, epithelial lining.
Okay, so welcome to another session of us having a tete-a-tete, a chat on pharmaceutical chemistry. This is the New Chemist podcast, and we're going to be referencing some notes from my professor, specifically Dr. Kulkarni, referencing his notes at Howard, and we're going to be discussing some key ideas associated with antidepressants. Of course, it's important to note that these episodes are in no way, shape, or form a version of medical advice, counseling, or consultation. Please correspond and speak with and rely on the advice of your medical professionals, such as your physicians, physician assistants, nurse practitioners, and pharmacists. Once again, these advice are not for medical advice, consultation, or counseling. Okay, so let's begin. We're going to be talking about antidepressant agents. So depression chemotherapy, tricyclic antidepressants, SNRIs, talk about that later, atypical agents, and all other good stuff. So let's keep going. Depression. It's a relatively common disorder. Approximately 1 out of 8 people will require treatment for depression sometime during his or her lifetime. In general, women are approximately this is a statistic. In general, women are approximately twice as likely to suffer from depression as compared to men. That's a statistic. 9.3% versus 4.5%. Depression is often an under-recognized and under-treated disorder. Patients are present with somatic instead of psychological systems. So patients often present with somatic instead of psychological systems. Patients with depression are reported to have more physical pain and display worse physical, social, and occupational function than people without depression. Suicide is identified as a major cause of mortality in patients with major depression. Risk factors for depression include family history for depression, substance abuse, and gender. Depression is more common in patients with hypothyroidism, multiple sclerosis, Huntington's disease, Cushing's syndrome, diabetes mellitus, etc. Okay, so depression models. The biogenic amine hypothesis. It links deficits in physiology and metabolism of biogenic amines, noradrenaline, 5-HT, dopamine, etc. to depression. Tricyclic antidepressants increase the amounts of norepinephrine and serotonin in synapses by blocking their uptake. This process is referred to as reuptake and is known to diminish the biological impact of these neurotransmitters. Monoamine oxidase inhibitors, MAOIs, block the oxidative degradation of norepinephrine, serotonin, and other neurotransmitters. A more appropriate model is the dysregulation model of depression that suggests that impairment in one or more neurotransmitter, homeostatic or regulatory mechanisms leads to the depression pathophysiology. Antidepressant agents classification. So you have your monoamine oxidase inhibitors, so MAOIs. Irreversible ones are irreversible types include isocarboxazid, iproniazid, phenylxine, and tranylcypromine. Reversible ones include moclobemide and chlorgelin. So for the tricyclic antidepressants, you have your norepinephrine and 5-HT3 uptake inhibitors. So imipramine, amitriptyline, doxepin, thiopin, and chlormipramine. For the norepinephrine uptake inhibitors, you have decimipramine, nortriptyline, and amoxicillin. For selective serotonin reuptake inhibitors, you have your fluoxetine, fluvoxamine, citrulline, and citalopram. For your atypical antidepressants, you have your trazodone, Okay, so your monoamine oxidase inhibitors. Monoamine oxidase converts biologically active primary amines into the corresponding aldehydes. The enzyme mediates a redox reaction. It oxidizes the amine substrate and reduces FAD into FADH2. In humans, monoamine oxidase exists in two forms. So you have monoamine oxidase A and monoamine oxidase B. They both are found in the central nervous system. Monoamine oxidase A is also found in the liver, lungs, GI tract, and placenta. Monoamine oxidase B is mostly found in platelets. Okay, so monoamine oxidase inhibitors. Monoamine oxidases are flavin-containing enzymes that use molecular oxygen as the stoichiometric oxidant. Serotonin, melatonin, epinephrine, and norepinephrine primarily undergo monoamine oxidase A mediated metabolism. Compounds like dopamine, tyramine, tryptamine undergo metabolism both by monoamine oxidase A and monoamine oxidase B. Monoamine oxidase inhibitors inhibit the oxidative deactivation of compounds like dopamine, serotonin, norepinephrine, etc., and can be used in the treatment of depression. Severe side effects associated with these agents limit their use treating patients with resistant depression that do not respond adequately to other therapies, particularly tricyclic antidepressants. Okay, so let's keep going. So you have your isocarboxazide. So we're talking about irreversible monoamine oxidase inhibitors. Your isocarboxazide. So isocarboxazide belongs to the hydrazine class of non-selective irreversible monoamine oxidase inhibitors. It is primarily used for the treatment of mood and anxiety disorders. Phenelzine is a non-selective, irreversible monoamine oxidase inhibitor. It is an antidepressant and anxiolytic agent. Its use is indicated primarily in the treatment of major depressive disorder. It is also effective for the treatment of bipolar depression / panic disorder, social anxiety behavior, etc. Tranylcypromine is a non-selective, irreversible monoamine oxidase inhibitor. It is used in the treatment of major depressive disorders, especially in cases where depression is associated with anxiety. So it is typically used in patients who do not respond well to reuptake inhibitor antidepressants. Okay, so irreversible monoamine oxidase inhibitors. You have your drug-food interactions. Let's talk about those. Monoamine oxidase is primarily responsible for the oxidative deamination of tyramine, a compound that helps regulate the blood pressure. Inhibition of monoamine oxidase leads to a buildup of tyramine and may lead to a hypertensive crisis. As a consequence, tyramine-containing foods such as aged cheeses, cured meats, soybeans, yeast-containing foods, etc. should be avoided during monoamine oxidase inhibitor treatment. Hypertensive crisis usually presents with the following symptoms: severe headache, nausea, vomiting, vision disturbances, irregular heart rate, chest pain, nosebleed, fainting, etc. Patients should seek immediate medical help if these symptoms develop. Okay, so let's keep going. You have your administration of paroxetine, fluoxetine, amitriptyline, etc. It should be avoided along with the irreversible monoamine oxidase inhibitors. These drug combinations may cause high levels of serotonin, leading to confusion, high blood pressure, tremors, coma, and death. Co-administration of agents that cause vasoconstriction, such as phenylephrine, ephedrine, pseudoephedrine, along with monoamine oxidase inhibitors, can cause acute hypertensive crisis. Oftentimes, these agents are present in many over-the-counter preparations, etc. Or example, phenylephrine in some medications, thereby increasing the chances of drug-drug interactions. Co-administration with agents like carbamazepine causes a significant increase in the serotonin levels, leading to serotonin syndrome. Reversible monoamine oxidase inhibitors. Moclobemide, reversible inhibitor of monoamine oxidase A, so RIMA, reversible inhibitor of monoamine oxidase A, so RIMA, reversible R, inhibitor I, of monoamine A oxidase inhibitor. It is used primarily for the treatment of depression and social anxiety. No significant rise in blood pressure is reported when moclobemide is co-administered with tyramine-containing foods or other amine drugs like noradrenaline. The drug is indicated for the treatment of major depressive disorder, bipolar depression, and social anxiety disorders. Much safer drug as compared to irreversible monoamine oxidase inhibitors, with much less side effects. Common side effects associated with moclobemide include insomnia, headache, and dizziness. Most side effects are transient and disappear within the first 2 weeks of treatment. So reversible monoamine oxidase inhibitors, selegiline is substituted phenethylamine. At therapeutic doses, the drug is a selective and irreversible monoamine oxidase B inhibitor. When given in large doses, it also inhibits monoamine oxidase A. It also displays neuroprotective properties, protecting the nearby neurons from free oxygen radicals that are released during monoamine oxidase B mediated oxidative deamination. The drug is used to treat depression, major depressive disorder, as a transdermal patch. The drug is given orally along with L-dopa to treat symptoms of Parkinson's disease. So reversible monoamine oxidase inhibitors, selegiline. The drug has only modest oral bioavailability, approximately 10%, but due to its lipophilic nature, its oral bioavailability increases considerably when co-administered with a fatty meal. Typical side effects include nausea, hallucinations, confusion, loss of balance and insomnia, slow or irregular heart rate, syncope have also been reported as side effects. So your SNRIs, we're talking right now about tricyclic antidepressants. So your selective norepinephrine reuptake inhibitors. In general, the noradrenergic pathway is associated with increased drive, when serotonin pathway is associated with mood alteration. So the noradrenergic pathway is associated with increased drive, whereas serotonin pathway is associated with mood alterations. Thus, selective serotonergic reuptake inhibitors, SSRIs, and selective norepinephrine reuptake inhibitors, SNRIs, provide therapeutic benefits by parallel and independent pathways. Chemically, these compounds are secondary amines. The tricyclic structure can be formed by the fusion of the phenyl, substituted phenyl rings, either with 6, example, propylene, or 7-membered rings, protryptyline, etc. The 7-membered ring can either be carbocyclic or heterocyclic, so amoxapine. So it can be carbocyclic or heterocyclic, like amoxapine. For selective norepinephrine reuptake inhibitors, the side chain is usually comprised of a 3-carbon unit and connects the tricyclic framework to the secondary amine. In general, secondary amine TCAs are well absorbed using oral administration. They have good bioavailability, usually between 60 to 95%. Their onset of action typically takes 2 to 3 weeks or longer. Okay, selective norepinephrine reuptake inhibitors. The exact mechanism of action for these compounds is not understood. These compounds display substantially higher affinity for inhibiting the norepinephrine transporter. Generally, 2-amine, secondary amine, tricyclic antidepressants do not show significant affinity at the dopamine transporter. Generally, secondary amine tricyclic antidepressants do not show significant affinity at the dopamine transporter. Blocking norepinephrine reuptake increases its concentration in the synaptic cleft and its ability to interact with postsynaptic norepinephrine receptors. Generally, N-demethylation and aromatic ring hydroxylation are the two most common routes of metabolism. These compounds are indicated for the treatment of major depressive episodes, persistent depressive disorder, panic disorder, attention deficit disorder, etc. Typically, adverse effects associated with these agents are attributed to their ability. One more time. Typically, adverse effects associated with these agents are attributed to their ability to block muscarinic, alpha-1 adrenergic receptors, H1 receptors, etc. Side effects include dry mouth, constipation, painful urination, emptying difficulty, blurred vision, sexual dysfunction, daytime drowsiness. So norepinephrine and drug interactions. Norepinephrine inhibitors, norepinephrine reuptake inhibitors, drug interactions. Because of their narrow therapeutic window, important to note, because of the narrow therapeutic window, these are not the drugs of choice for the treatment of depression. Concurrent administration of TCAs with monoamine oxidase inhibitors is contraindicated, and at least 2 weeks should elapse before discontinuation of the tricyclic antidepressant therapy, initiation of the monoamine oxidase therapy, or vice versa. Co-administration of serotonin reuptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors may result in severe hypertension. Secondary amine TCAs are inhibitors of sodium channels. Secondary amine tricyclic antidepressants are inhibitors of sodium channels, thus can slow ventricular conduction at the therapeutic dose. Drug overdose is required to produce ventricular arrhythmia, which could often be fatal. Blockage of sodium channels in the central nervous system may lead to seizures. The use of alcohol must be avoided concurrent to the TCA or tricyclic antidepressant therapy. With the tricyclic antidepressants, desipramine is an active metabolite of imipramine. The drug is primarily metabolized by CYP2D6 and CYP1A2 and CYP2C19. Long-term therapy causes downregulation of norepinephrine transporters as a consequence of the homeostatic mechanism. The CYP2D6 induces rifampin, and inhibitors amiodarone and chloroquine can alter the plasma concentration of desipramine. So we talk about drug interactions. And also, desipramine can be also some of these drugs we're referring to can be secreted into milk, so it's contraindicated in nursing mothers. So tricyclic antidepressant, amoxapine. The drug displays antidepressant, antipsychotic effects. It is N-methylated. It is an N-methylated analog of loxapine. So it is an N-methylated analog of loxapine. It is structurally unique since it contains both nitrogen and oxygen in the central 7-membered ring and contains a pyrazine ring instead of propylamine side chain. as potent inhibitor of norepinephrine reuptake as compared with other secondary tricyclic antidepressants. The compound is rapidly and completely absorbed from the GI tract. The drug undergoes CYP3A4-mediated hydroxylation to 7,8-hydroxyamoxapine. The metabolites are pharmacologically active. So non-tricyclic secondary amine antidepressants. Reboxetine. Reboxetine is a selective norepinephrine reuptake inhibitor that does not possess tricyclic structure commonly seen in this class of compounds. It is a potent and selective norepinephrine transporter inhibitor. Mechanism of action similar to desipramine, the drug displays comparatively low affinity for muscarinic receptors. It is indicated for the treatment of major depressive disorders. It is particularly used in patients who do not respond adequately to selective serotonin reuptake inhibitors, or in cases where the use of other tricyclic antidepressants is contraindicated. The drug shows excellent oral bioavailability, greater than 90%, nausea, diarrhea, and somnolence, so drowsiness is quite a side effect of this drug. It's important to note, we're now talking about atomoxetine, so a non-tricyclic secondary amine antidepressant. It belongs to the phenoxyphenylpropylamine class. The R isomer is approximately 10 times more potent and selective norepinephrine reuptake inhibitors. It belongs to phenoxyphenylpropylamine class. The R isomer is approximately 10 times more potent as a selective norepinephrine reuptake inhibitor than the S isomer, so R is more potent than S in this case. The drug is approved for the treatment of attention deficit hyperactive disorder, ADHD, in children, adolescents, and adults. It is a non-stimulant compound and has very low abuse potential. It displays good norepinephrine transporter versus dopamine transporter selectivity. Okay, atomoxetine inhibits cardiac potassium currents and may cause arrhythmia. The drug is contraindicated in patients with atrial fibrillation, ventricular fibrillation, and ventricular tachycardia. Concomitant monoamine oxidase inhibitor treatment is contraindicated. The drug is contraindicated in patients with moderate to severe hypertension. Adverse effects include nausea, dry mouth, fatigue, drowsiness, tachycardia, hypertension, irritability, etc. Serotonin norepinephrine reuptake inhibitors. These drugs block norepinephrine transporters and serotonin reuptake transporters in a non-selective manner. Consequently, these compounds combine mechanism of action of selective serotonin reuptake inhibitors and norepinephrine reuptake inhibitors. Clinically, these classes of compounds seem to be advantageous in the management of depression. They increase the concentration of norepinephrine and 5-HT at the synaptic cleft. The in vivo activity of these classes of compounds is complex, since N3-methylation, common metabolic route for these classes of compounds, leads to selective norepinephrine reuptake inhibition. The serotonin norepinephrine reuptake inhibitors, SNRIs. Their use is indicated in patients with major depressive disorder, especially in patients who do not respond adequately to norepinephrine reuptake inhibitors or selective serotonin reuptake inhibitors. The side chain for these compounds features a 3-carbon propylene bridge that connects the tricyclic framework to tertiary amine. Pharmacokinetics versus effects, etc., are similar to norepinephrine reuptake inhibitors. So when we talk about these tertiary amine tricyclic antidepressants, we're talking about imipramine, amitriptyline, doxepin, chlomipramine. So let's keep going. Non-tricyclic selective norepinephrine reuptake inhibitors, the venlafaxine. It was hypothesized that SNRIs that lack the classical tricyclic structure should have minimal side effects. Research led to the discovery of venlafaxine. Venlafaxine is indicated for the treatment of major depression, generalized anxiety disorder, panic disorder, and social phobia. tricyclic antidepressant, venlafaxine, does not show any appreciable affinity for the alpha-1 adrenergic cholinergic H1 receptors ion channels. Venlafaxine produces faster and greater antidepressant response as compared to SSRIs alone, suggesting SSRI selective serotonin reuptake inhibitors alone, suggesting a synergy between 5-HT and norepinephrine mediated pathways. At lower doses, the drug only affects the serotonin transmission. At moderate doses, venlafaxine affects both serotonergic and norepinephrine systems at high doses. It can also affect dopamine neurotransmission. The drug shows excellent oral bioavailability. Let's keep going. Patients must be warned about the possible suicide risk. The drug is contraindicated in children and young adults. The drug is associated with discontinuation syndrome with symptoms such as dysphoria, headaches, nausea, irritability, sensation of electrical shocks, sleep disturbance. The drug is associated with discontinuation syndrome with symptoms such as dysphoria, headaches, nausea, irritability, sensation of electric shocks, sleep disturbance, etc. It undergoes O and N demethylation mediated by CYP2D6 and CYP3A4 respectively. So selective serotonin reuptake inhibitors, sertraline. Sertraline displays high affinity for serotonin reuptake transporters, and then to a lesser extent, dopamine transporters. Thus, it increases serotonin and dopamine concentration in the synaptic cleft. It is indicated for the treatment of major depressive disorder, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, etc. Common side effects include diarrhea, trouble with sleep, sexual dysfunction. It may increase the risk of suicide in patients less than 25 years old. N-demethylation is the most common metabolic route, leading to a significant loss of activity. This episode do not show any structures. You can Google the structures. We give you the names. Remember, these types of issues it's important to take note that these episodes are not a form of medical advice or consultation or counseling. Very important to note. Atypical antidepressant, this is just for intellectual curiosity, used in monotherapy or along with selective serotonin reuptake inhibitors. It undergoes CYP2D6 mediated oxidative metabolism to hydroxybutyrione today. Good luck.
Welcome to the New Student Pharmacist podcast, the podcast series, The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We look forward to your subscriptions to support the work we are doing and follow us on Spotify and Apple Podcasts. Note, the views on the podcast represent those of my guest and I. We encourage you to subscribe on Spotify and Apple Podcasts
300
to support
drugs.
our work.
Brand / generic / class / indication 1. Lortab, hydrocodone / acetaminophen opioid pain 2. Vicodin, hydrocodone / acetaminophen opioid pain 3. Lorcet, hydrocodone / acetaminophen opioid pain 4. Norco, hydrocodone / acetaminophen opioid pain 5. Synthroid, levothyroxine T4 hypothyroidism 6. Levoxyl, levothyroxine T4 hypothyroidism 7. Levothyroid, levothyroxine T4 hypothyroidism 8. Prinavil, lisinopril ACE hypertension / proteinuria 9. Zestrol, lisinopril ACE hypertension / proteinuria 10. Xanax, alprazolam benzo anxiety 11. Fortamit, metformin biguanide diabetes 12. Glumetza, metformin biguanide diabetes 13. Glucophage, metformin biguanide diabetes 1 / 29 top 300 drugs. Brand / generic / class / indication 14. Lasix, furosemide loop diuretic hypertension / edema 15. Preluzec, omeprazole PPI GERD 16. Zocor, Simvastatin HGM-CoA reductase inhibitor dyslipidemia 17. Livalo, pitavastatin HGM-CoA reductase inhibitor dyslipidemia 18. And Skol, fluvastatin HGM-CoA reductase inhibitor dyslipidemia, take at bedtime, 19. Lipita, atavastatin HGM-CoA reductase inhibitor dyslipidemia 20. Norfasc, amlodipine DHP calcium channel blocker hypertension 21. Proventil, albuterol short-acting beta agonist rescue inhaler 22. Ventolin, albuterol short-acting beta agonist rescue inhaler 23. Proair, albuterol short-acting beta agonist rescue inhaler 24. Ambien, zolpidem imidazopyridine sleep 25. Celexa, citalopram SRI anxiety /depression 2 /29 top 300 drugs, brand /generic /class /indication 26. Hydrodiuryl, hydrochlorothiazide thiazide diuretic hypertension 27. Neurontin, gabapentin GABA analog nerve pain, epilepsy 28. Zantac, ranitidine H2 rugged 29. Ultram, tramadol central acting analgesic pain 30. Bayers, aspirin said pain /inflammation /antiplatelet 31. Ecatrin, aspirin said pain /inflammation /antiplatelet 32. Cadia, potassium supplement potassium low potassium 33. Clocon, potassium supplement potassium low potassium 34. Clonopin, clonazepam benzo anxiety /depression 35. Coumadin, warfarin anticoagulant 36. Jantoven, warfarin anticoagulant 37. Singulair, montelukast oral nicotriene receptor antagonist asthma /respiratory also seasonal allergic rhinitis 38. Laprasa, metoprolol tartrate selective BB hypertension /HF3 /29 top 300 drugs, brand /generic /class indication 39. Ambrx, cyclobenzaprine muscle relaxer 40. Flecaryl, cyclobenzaprine muscle relaxer 41. Fexmid, cyclobenzaprine muscle relaxer 42. Seroquel, quetiapine fumarate atypical antipsychotic schizophrenia /bipolar 43. Plavix, clopidogrel antiplatelet stroke prevention 44. Oxycontin, oxycodone opioid pain 45. Decyl, trazodone tetracyclic antidepressant labeled for depression but usually sedative off-label 46. Coreg, carvedilol 47. Mevaca, lovastatin HMO-CoA reductase inhibitor dyslipidemia 48. Zoloft, sertraline SSRI anxiety /depression 49. Cymbalta, duloxetine SNRI anxiety /depression 50. Percocet, roxicet, Endocet, oxycodone /acetaminophen CII opioid pain 51. Advair, fluticasone propionate /salmeterol zinarfote bronchodilator asthma /COPD 4 /29 top 300 drugs, brand /generic class indication 52. Lantus, insulin glargine, rDNA origin, insulin diabetes 53. Tuyo, insulin glargine, rDNA origin, insulin diabetes ** 300 unit /ml ** 54. Simlin, Simlin pen, pramlintide analog of amylin hormone diabetes ***** do not give if skip a meal ***** 55. Tarprul XL, metoprolol succinate cardioselective BBHTN 56. Zebieta, bisoprolol 57. Zithromax, Zmix, azithromycin macrolide bacterial infections 58. Prozac, fluoxetine SSRI anxiety / depression 59. Efega, venlafaxine SNRI anxiety / depression / nerve pain 60. Tenormin, atenolol cardioselective BBHTN 61. Elavil, amitriptyline SNRI anxiety / depression / nerve pain 62. Combivant, ipratropium bromide / albuterol sulfate, MDI, COPD, asthma 63. Wellbutrin, bupropion norepinephrine dopamine reuptake inhibitor antidepressant / smoking aid 64. Zibin, bupropion norepinephrine dopamine reuptake inhibitor antidepressant / smoking aid 5 / 29 top 300 drugs. Brand / generic / class / indication 65. Nexium, esomeprazole PPI GERD 66. Ativan, lorazepam benzo anxiety / panic attacks 67. Trisa, phenofibrate dyslipidemia / triglycerides **** take with food cc *** 68. Lexapro, escitalopram SSRI anxiety / depression 69. Flonase, fluticasone propionate nasal corticosteroid nasal congestion 70. Deltasone, prednisone steroid inflammation / allergy / immunosuppression 71. Depakote, divalproe valproic acid seizure / bipolar 72. Catapraz, clonidine alpha agonist hypertension / sedative / ADHD 73. Aldome, methyldopar alpha agonist hypertension 74. Cardizem, diltiazem CCBHTN and angina 75. Karsha, diltiazem 76. Tiazic, diltiazem CCBHTN and angina 6 / 29 top 300 drugs. Brand / generic / class / indication 77. Soma, carisoprodol carbamate muscle relaxer 78. Risperdal, risperidone atypical antipsychotic schizophrenia / antipsychotic 79. Mobic, meloxicam said anti-inflammatory 80. Detrol, toltrodine cholinergic incontinence 81. Topamax, topiramate anticonvulsant seizure / nerve pain 82. Martrin, ibuprofen said pain / inflammation 83. Amoxil, amoxicillin trihydrate penicillin bacterial infection 84. Trimox, amoxicillin trihydrate penicillin bacterial infection 85. Moxatag, amoxicillin trihydrate penicillin bacterial infection 86. Naproxen, naproxen 87. Zestoritic, lisinopril / hydrochlorothiazidase inhibitor and thiazide diuretic HTN 88. Prinzide, lisinopril / hydrochlorothiazidase inhibitor and thiazide diuretic HTN 89. Riglan, metoclopramide prokinetic nasio / GERD 7 / 29 top 300 drugs. Brand / generic / class / indication 90. Bactrim, sulfamethoxazole / trimethoprim sulfur antibiotic bacterial infection 91. Septra, sulfamethoxazole / trimethoprim sulfur antibiotic bacterial infection 92. Actos, pioglitazone thiazolidine diabetes 93. Abilify, aripiprazole atypical antipsychotic schizophrenia /antipsychotic 94. Fosamax, alendronate bisphosphonate osteoporosis 95. Spiriva, sheotropium bromide inhalation bronchodilator COPD 96. Flomax, tamsulosin alpha blocker BPH 97. Lyrica, pregabalin anticonvulsant nerve pain 98. Micronase, glyburide sulfonylurea diabetes 99. Diabeta, glyburide sulfonylurea diabetes 100. Aricept, donepezil cholinesterase inhibitor Alzheimer's 101. Cresta, rosuvastatin HGMO co-reductase inhibitor dyslipidemia 102. Valium, diazepam benzo anxiety /panic attacks 8 /29 top 300 drugs, brand /generic class /indication 103. Aldactone, spironolactone potassium sparing diuretic HF, HTN 104. Inspra, eplerenone potassium sparing diuretic HF, HTN 105. Bistolic, nebivolol 106. Tecturna, aliskiren plus HCTZ 107. Valterna, aliskiren and valsartan 108. Protonix, pantoprazole 109. Lamictal, lamorigine antipyletic seizure 110. Xopnex, levolbuterol labor asthma /COPD 111. Glucotrol, glucotrol XL, glipizide sulf diabetes 112. Allegra, fexufenadine antihistamine hives itching allergy 113. Pravacol, pravastatin HGMO co-reductase dyslipidemia 114. Premarin, estrogens conjugated cream estrogen menopause 115. Imda, ismo, isosorbide mononitrate nitrate angina, HTN 116. Monoke, isosorbide mononitrate nitrate angina, HTN 9/29 top 300 drugs, brand /generic class /indication 117. Isordil, dilatrate, isosorbide dinonitrate nitrate angina, HTN 118. Cipro, ciprofloxacin fluoroquinolone bacterial infection 119. Dizide, trienterine /hydrochlorothiazide diuretic HTN 120. Maxazide, trienterine /hydrochlorothiazide diuretic HTN 121. Fnagan, promethazine antihistamine allergies, pain, nausea 122. Xyloprim, allopurinol xanthine oxidase inhibitors gout 123. Nitrostat, nitroglycerin nitrates angina 124. Nitroquick, nitroglycerin nitrates angina 125. Prevacid, lansoprazole PPI GERD 126. Paxil, paroxetine SSRI anxiety /depression 127. Pexiva, paroxetine SSRI anxiety /depression 128. Vibramycin, doxycycline hiclate tetracycline antibiotics bacterial infection 129. Vibratabs, doxycycline hiclate tetracycline antibiotics bacterial infection 10/29 top 300 drugs, brand /generic class /indication 130. Adra, amphetamine /dextroamphetamine salts CII amphetamine ADHD 131. Novolog, insulin aspart, rDNA origin insulin diabetes 132. Namenda, memantine NMDA receptor blocker Alzheimer's 133. Duragesic, fentanyl transdermal opioid chronic pain 134. Remeron, mirtazepine SNRI anxiety / depression 135. Zetia, ezetimibe cholesterol absorption inhibitor dyslipidemia 136. Celebrex, celecoxib said pain / inflammation 137. Diovan, valsartan angiotensin reductase inhibitor HTN 138. Atarax, hydroxyzine HCl, OTC, antihistamine sleep, itching allergy, anxiety 139. Unizorm, doxylamine antihistamine sleep 140. Inderal, propranolol non-selective BB hypertension / HF 141. Brevibloc, esmolol 142. Inopran XL, propranolol non-selective BB hypertension / HF 11 / 29 top 300 drugs, brand / generic / class / indication 143. Lanoxin, digoxin cardiac glycoside arrhythmia and HF 144. Lanoxicaps, digoxin cardiac glycoside arrhythmia and HF 145. Digitc, digoxin cardiac glycoside arrhythmia and HF 146. Dristol, vitamin D2, ergocalciferol inactive vitamin D bone health 147. Roquetrol, vitamin D3, calcitriol active vitamin D bone health 148. Amaryl, glympyride sulfura diabetes 149. Prandin, ripaglinide mglytinids rapid acting glinids 150. Starlix, nateglinide mglytinids rapid acting glinids 151. Vitarin, ezetimibe / simvastatin cholesterol absorption inhibitor plus HGMO co-cholesterol 152. Folate, folic acid deficiency / megaloblastic anemia 153. Folacin, folic acid B vitamin folic acid deficiency / megaloblastic anemia 154. Troylglutamine acid, folic acid B vitamin folic acid deficiency / megaloblastic anemia 155. Kiflex, cefalexin monohydrate cef antibiotic bacterial infection 12 / 29 top 300 drugs, brand / generic / class / indication 156. Vazotc, enalapril maleate ACEHTN 157. Buspa, buspionazapirone anxiety 158. Tegretol, carbamazepine antiepileptic seizure / nerve pain 159. Carbatrol, carbamazepine antiepileptic seizure / nerve pain 160. Equetrol, carbamazepine antiepileptic seizure / nerve pain 161. Coza, losartan potassium ARBHTN 162. Ritalin, methylene, metadate, methylphenidate phenethylamine and piperidine ADHD 163. Ditropin, oxybutynine chloride, oral, antispasmodic overactive bladder 164. MS-Contin, morphine sulfate extended release opioid pain 165. Slow-Fe, ferrous sulfate iron anemia 166. Ledodim, lidocaine transdermalamide local anesthetic pain for local area 167. Nefex, iron polysaccharide iron anemia 168. Cineme, Carbidopa /levodopa dopaminergic agent Parkinson's 13 /29 top 300 drugs. Brand / generic / class / indication 169. Duopa, carbidopa / levodopa dopaminergic agent enteral suspension 170. Ritari, carbidopa / levodopa dopaminergic agent cap 171. Stalevo, levodopa / carbidopa and entacapone, Cantan, 172. Zenaflex, tizonidine centrally acting ±2 adrenergic agonist muscle spasms muscle relaxant 173. Lioresal, baclofen muscle relaxant 174. Isoptin, verapamil non-DHP-CCBHTN, angina 175. Calan, verapamil non-DHP-CCBHTN, angina 176. Vrilan, verapamil non-DHP-CCBHTN, angina 177. Requip, ropinirole dopamine agonist Parkinson's 178. Scalaxin, metaxalone muscle relaxant muscle relaxer, pain 179. Restoral, temazepam benzo anxiety 180. Bentyl, dicyclomine gut antispasmodic IBS 181. Cerex, oxazepam benzo anxiety 14 /29 top 300 drugs. Brand / generic / class / indication 182. Visterol, hydroxyzine pamoate antihistamine anxiety, itching 183. Dilantin, phenytoin sodium extended anticonvulsant seizure 184. Capsules, phenytoin sodium extended anticonvulsant seizure 185. Diovan HCT, valsartan / hydrochlorothiazide ARB plus thiazide HTN 186. Diflucan, fluconazole antifungal 187. Humulin, insulin diabetes 188. Flovent, fluticasone propionate inhalation steroid and decongestant 189. Lateral, amlodipine / benazepril 190. Exforge, amlodipine / valsartan CCB / ARBHTN 191. Aza, amlodipine / omasartan CCB / ARBHTN 192. Phenarphine with codeine, acetaminophen / codeine pain 193. Tylenol #3, acetaminophen / codeine pain 194. Trileptal, oxcarbazepine anticonvulsant seizure 195. Lithianate, lithium carbonate mood stabilizer bipolar disorder 15 /29 top 300 drugs. Brand / generic / class / indication 196. Lithotabs, lithium carbonate mood stabilizer bipolar disorder 197. Lithobid, lithium carbonate mood stabilizer bipolar disorder 198. Mirapex, pramipexole dihydrochloride dopamine agonist Parkinson's and restless leg 199. Nistap, nystatin topical antifungal fungal infection 200. Nasonex, mometazone furoate monohydrate intranasal nasal congestion / allergic rhinitis 201. Augmentin, amoxicillin / clavulinate potassium bacterial infection 202. Estrase, estradiol menopause 203. Latensin, benazepril ACEHTN 204. Tesalorm, benzoatate antitussive cough 205. Kenalog, Triamcinolone acetonide topical corticosteroid itching /rash 206. Altase, Ramipril ACE 207. Levaquin, levofloxacin fluoroquinolone bacterial infection 208. Keppra, levetiracetam antiepileptic seizure 209. Geodon, ziprasidone antipsychotic ***** always take with food, similar to lurasidone **** 16 / 29 top 300 drugs. Brand / generic / class / indication 210. Latuda, lurasidone antipsychotic **** always take with food, similar to ziprasidone **** 211. Fanapt, iloperidone antipsychotic **** same QT prolongation risk as ziprasidone **** 212. Prolixin, flufenazine first generation antipsychotic if decanoate is the salt, 2 to 4 weeks 213. Humalog, insulin lispro, rDNA origin diabetes 214. Methadose, methadone pain / opioid withdrawal 215. Apidra, insulin glulisine diabetes 216. Lopid, gemfibrozil fibrate cholesterol / triglyceride **** take 3 hours before breakfast and dinner **** 217. Binicar, omezartan medoxamil 218. Furacet, butalbital / acetaminophen / caffeine migraine 219. Medrol, methylprednisolone steroid inflammation / rash / allergies 220. Pepside, famotidine H2 blocker GERD 221. Elunister, esopiclone sedative insomnia 222. Altracet, tramadol / acetaminophen pain 223. Trexaul, methotrexate daily for cancer weekly for Ra 17 / 29 top 300 drugs. Brand / generic / class / indication 224. Januvia, sitagliptin DPP4 inhibitors diabetes 225. Cardura, doxazosin ±1 selective alpha blocker 226. Juvisync, sitagliptin and simvastatin 227. Genume, sitagliptin and metformin 228. Minipress, prazosin ±1 selective alpha blocker BPH and HTN 229. Hitrin, trazocin ±1 selective alpha blocker 230. Binicar HCT, omezartan medoxamil / hydrochlorothiazide ARB and thiazide HTN 231. Actonel, risedronate bisphosphonate osteoporosis 232. Imita E, sumatriptan migraine 233. Lomatil, dipenoxylate / atropine centrally active opioid diarrhea 234. Antivert, dramamine, meclizine nausea 235. Cogentin, benztropine Parkinson's 236. Felden, piroxicam said anti-inflammatory / pain 237. Cleocin, clindamycin oral lincosamide bacterial infection 238. Zavirox, acyclovir herpes, shingles chicken pox 18 / 29 top 300 drugs. Brand / generic / class / indication 239. Procardia, nifedipine DHP CCBHTN 240. Nifedical, nifedipine DHP CCBHTN 241. Adele, nifedipine DHPCCBHTN 242. Bumex, bumetanide diuretic HTN 243. Vasicare, sulfenacin bladder relaxant overactive bladder 244. Acupril, quinapril-ace HTN 245. Trivara, trifazole, Impris, levonorgestrel /ethinyl estradiol contraceptive 246. Avandia, rosiglitazone thiazolidinedione diabetes 247. Fnagan with codeine, promethazine /codeine cold medicine, opioid with HH1 antihistamine 248. Glucovance, glyburide /metformin sulf and biguanide diabetes 249. Novolin 70 /30, insulin Novolin diabetes insulin 250. Mitaglip, glipizide /metformin sulf and biguanide diabetes 251. Tricycle, tricycle low, trisprintic, Trinessa, Norgestimate /ethinyl estradiol contraceptive 252. Zyprexa, olanzapine schizophrenia /antipsychotic 19 /29 top 300 drugs, brand /generic class indication 253. Yasmin, Ocella, drospirenone /ethinyl estradiol birth control 254. Voltaren, diclofenac sodium oral, can also be gel for pain, NSAID anti-inflammatory and pain 255. Agrinox, dipyridamole /aspirin antiplatelet to prevent stroke 256. Boniva, ibandronate bisphosphonate osteoporosis 257. Compazine, prochlorperazine phenothiazine class antipsychotic, anti-nausea and anxiety 258. Compro, prochlorperazine phenothiazine class antipsychotic, anti-nausea and anxiety 259. Bactroban, mupirocin antibiotic for skin infections 260. Macrodantin, nitrofurantoin antibiotic for UTI 261. Furodentin, nitrofurantoin antibiotic for UTI 262. Macrobid, nitrofurantoin antibiotic for UTI 263. Latrisone, clotrimazole /betamethacindipropion steroid /antifungal. It can treat fungal infections 264. Flagyl, metronidazole antibiotic 265. Robaxin, methocarbamol muscle relaxant. It can treat muscle spasms and pain. 266 Tushnex, chlorpheniramine /hydrocodone antihistamine /narcotic and narcotic. It can treat cough 267. Ivista, raloxifene estrogen modulator osteoporosis 20 /29 top 300 drugs, brand /generic class indication 268. Provigil, modafinil stimulant for narcolepsy 269. Nuvigil, armodafinil stimulant for narcolepsy 270. Carafate, sucralfate antacid. It can treat ulcers 271. Enables, derifenacin overactive bladder 272. Niaspan, niacin cholesterol medication and vitamin. It can treat high cholesterol and triglyceride levels as well as niacin deficiency. 273 Astelin, azilastin nasal itchy stuffy runny nose 274. Relafen, nabumtan said, anti-inflammatory. It can treat pain and arthritis. 275 Valteri, valacyclovir herpes, shingles, chicken pox 276. Armothyroid, thyroid, desiccated, T3 and T4 hypothyroid 277. Zafran, ondansetron nausea / vomiting 278. Acifex, rabeprazole PPI GERD 279. Sinequan, docupin TCA anxiety / depression 280. Theocron, Theo24, theophylline anhydrous asthma, emphysema COPD 281. Chantix, varenicline tartrate smoking cessation 282. Timoptic, timolol maleate ophthalmic non-selective BB 283. Betopic, betaxolol ophthalmic selective BB 21 / 29 top 300 drugs. Brand / generic / class / indication 284. Ocuprus, cartilol ophthalmic selective BB 285. Omnisf, cefdinir antibiotic 286. Levemir, insulin detemir diabetes 287. Pristic, desvenlafaxine antidepressant 288. Biota, exenatide GLP-1 agonist diabetes 289. Lovasa, omega-3 acid ethyl esters triglyceride 290. Mycardis, telmisartan ARB-HTN 291. Zalatan, latanoprost glaucoma 292. Stratra, atomoxetine SNRI-ADHD 293. Vtids, PenVK, Veselin, penicillin V potassium 294. PenVK, penicillin V potassium 295. Veselin, penicillin V potassium 296. Atripla, efavirenz, imtricitabine, tenofovir disoproxil fumarate HIV 297. Plaquenil, hydroxychloroquine sulfate malaria in third world countries, RA and lupus in first world 298. Zaraoxolin, metalazone thiazide diuretic 299. Thalidan, chlorthalidone thiazide diuretic 300. Prisca, finasteride BPH 301. Mitacin AC, codeine / guaifenesin cough 302. Robitussin AC, codeine / guaifenesin cough 22 / 29 top 300 drugs. Brand / generic / class / indication 303. Minopril, fosinopril ACEIHTN and HF 304. Prempro, estrogen, conjugated, / medroxyprogesterone acetate estrogen replacement therapy for hot flushes caused by menopause 305. Patanol, olopatadine ophthalmic eye allergic conjunctivitis 306. Pataday, olopatadine ophthalmic eye allergic conjunctivitis 307. Mavic, trandelapril ACEHTN 308. Vivaldot, estradiol topical hormone replacement 309. Luminol, phenobarbital beribwate sedative 310. Sulfoten, phenobarbital beribwate sedative 311. Vicaprofen, hydrocodone / ibuprofen opioid pain 312. Orthocycle, Sprintic, Norgestimat / ethinyl estradiol contraceptive 313. Avalide, irbesartan / hydrochlorothiazide 314. Hyza, losartan / hydrochlorothiazide ARB and HCTC for HTN 315. Plendil, felidipine 316. Yaz, drospirenone / ethinyl estradiol contraceptive 317. Pulmicort, budesonide inhalation steroid asthma 318. Travatan, Travatan Z, Travoprost glaucoma 319. Zyzal, levetiracetam antihistamine for allergy 23/29 top 300 drugs. Brand /generic /class /indication 320. Nasacort AQ, triamcinolone acetonide intranasal allergy symptoms 321. Lostrin FE, microgestin FE, Tunal FE, norethindrone /ethinyl estradiol /ferrous fumarate contraceptive 322. Adipex B, phentermine appetite suppression for obesity 323. Ionamin, phentermine appetite suppression for obesity 324. Cordarin, amiodarin potassium channel blocker antiarrhythmic 325. Pacerone, amiodarin potassium channel blocker antiarrhythmic 326. Nizoral, ketoconazole antifungal 327. Avapro, irbesartan 328. Pamela, nortriptyline SNRI for depression 329. Arimidex, anastrozole estrogen for cancer 330. Avalox, moxifloxacin fluoroquinolone 331. Tamiflu, oseltamivir flu vaccine 332. Viagra, sildenafil citrate ed 333. Aprazoline, hydralazine HTN 334. Vivance, lisdexamfetamine dimesylate ADHD 335. Alphagon P, brimonidine tartrate glaucoma. Also it can treat facial redness caused by rosacea in its topical form 336. Lidex, fluoquinonide topical steroid. It can treat many skin disorders. It can also relieve pain, itching, and swelling of the skin. 24/29 top 300 drugs. Brand /generic /class /indication 337. Nystatin oral. Nystatin oral. This medication is used to treat fungal infections of the mouth. 338 Minokin, minocycline tetracycline antibiotic 339. Levsin, Levbid, Levsin-X, Hyosoyamine gut spasmodic for IBS 340. Levbid, Hyosoyamine gut spasmodic for IBS 341. Levsin-X, Hyosoyamine gut spasmodic for IBS 342. Cialis, tadalafil 343. Cosept, dorsalamide /timolol maleate /non-selective BB 344. Pyridium, phenazopyridine urinary tract pain 345. Peridex, chlorhexidine gluconate. Chlorhexidine is an antibacterial used as an antiseptic and for other applications 346. Periogod, chlorhexidine gluconate. Chlorhexidine is an antibacterial used as an antiseptic and for other applications 347. Lumagan, bimatoprost antiglaucoma. It can reduce pressure inside the eye in its eye drops form. As an eyelash solution, it can help eyelashes grow. 348 NuvaRing, etonogestrel /ethinyl estradiol vaginal contraceptive 349. Prometrium, progesterone oral menopause 350. Lamizil, terbinafine antifungal 351. Vigamox, moxifloxacin ophthalmic bacterial conjunctivitis 352. Sumicin, tetracycline antibiotic 353. Panmicin, tetracycline antibiotic 354. Tamuvate, clobetasol propionate topical steroid itching redness 25/29 top 300 drugs. brand / generic / class / indication 355. Provera, medroxyprogesterone acetate contraceptive or endometrial pain 356. Ofral, low / ofral, ogestrel, Crisel, Norgestrel with ethinyl estradiol contraceptive 357. Bioxin, clarithromycin macrolide antibiotic 358. Dimadex, torsemide diuretic edema or HTN 359. Indocin, indomethacin said, anti-inflammatory, it can treat pain. 360 Atacand, candesartan silex-ethyl ARB for HTN 361. Allegrity, fexufenadine / pseudopedrin allergy and congestion 362. Normodine, labetalol non-selective BBHTN 363. Trandate, labetalol non-selective BBHTN 364. Restasis, cyclosporine emulsion ophthalmic immunosuppressive agent used to treat chronic dry eye caused from inflammation 365. Mycardis HCT, telmisartan / hydrochlorothiazide ARB plus thiazide for HTN 366. Tenoritic, atenolol with chlorthalidone cardioselective BB plus diuretic 367. Mycolog 2, nystatin / triamaquinolone acetonide fungal skin infection and inflammation caused by it 368. Disogen, Apri, orthocept, disogestrel with ethinyl estradiol contraceptive 369. Oriprid, prednisolone sodium phosphate inflammation, multiple sclerosis, and arthritis. 370 Zyma, gatiflocasin ophthalmic bacterial conjunctivitis 371. Levitra, vardenafil ed 26 /29 top 300 drugs, brand / generic / class / indication 372. Staxin, vardenafil ed 373. Suboxone, buprenorphine / naloxone opioid withdrawal 374. Decadron, dexamethasone oral inflammation, allergic reactions, and flare-ups of ulcerative colitis. 375 Veramist, fluticasone furoate nasal allergy, congestion, sneezing, itching 376. Ciprodex, ciprofloxacin / dexamethasone treat outer ear infections 377. Focalin, dexmethylphenidate 378. Latensin HCT, benazepril / hydrochlorothiazide ACE and thiazide for HTN 379. Elicon, mometazone furoate topical eczema, psoriasis, allergies, and rash 380. Clarinex, disloratadine antihistamine it can treat or prevent hives, allergy symptoms 381. Nolvadex, tamoxifen citrate 382. Duomb, ipratropium bromide with albuterol sulfate solution bronchodilator it can treat COPD. 383 Conchata, methylphenidate 384. Oxy-IR, oxycodone-IR opioid pain 385. Roxicodone, oxycodone-IR opioid pain 386. Miralax, polyethylene glycol 3350, NF osmotic laxative 387. Glycolax, polyethylene glycol 3350, NF osmotic laxative 388. Zyac, bisoprolol / hydrochlorothiazide selective BB / thiazide diuretic HTN 27 / 29 top 300 drugs, brand / generic / class / indication 389. Lostrin 24-Fe, norethindrone acetate, ethinyl estradiol, ferrous fumarate contraceptive 390. Colchris, colchicine 391. Avodart, dutasteride BPH 392. Ceftin, sphioxymaxetyl oral CEF antiarbic 393. Ales, Avion, levonorgestrel with ethinyl estradiol contraceptive 394. Mercet, Cariva, disogestrel with ethinyl estradiol contraceptive 395. Necon 1/35, Orthonovum 1/35, norethindrone and ethinyl estradiol contraceptive 396. Prevnar, pneumococcal vaccine 397. Lupron, Luprolide GnRH agonist prostate cancer 398. Zoladex, Goserelin GnRH agonist prostate cancer 399. Zitiga, abiraterone androgen biosynthesis inhibitors, prostate cancer 400. Casodex, bicalutamide first generation anti-androgen prostate cancer 401. Firmagon, Degarelix GnRH antagonist, prostate cancer 402. Rainexar, ranelazine add-on therapy for stable angina, reduce oxygen demand, reduce number of attacks, 403. Nimotarp, nimodipine non-DHPCCB hemorrhagic stroke 404. Cardin, nicardipine CCB 28/29 top 300 drugs, brand / generic / class / indication for hypertensive 3 in ischemic stroke patient, labetalol is other option, 405. Osmitrol, mannitol hemorrhagic stroke 406. Invokana, canagliflozin SGLT2 diabetes 407. Farxiga, dapagliflozin SGLT2 diabetes 408. Jardiance, empagliflozin SGLT2 diabetes 409. Precose, acarbose alpha glucosidase inhibitor diabetes **** no meal, no drugs **** 410. Glyze, miglytyl alpha glucosidase inhibitor diabetes **** no meal, no drugs **** 411. Invirase, Scowinavimesylate not **** Scowinavi soft gel capsule **** 29/29.
I'm spitting rhymes with that medical twist, talking about the meds that make you exist. Epoetin, epogen, crit, anemia of cancer, you know we combat it. Erythromycin, fighting infections, bacterial invaders, they face rejections. Escitalopram, Lexapro, battling depression. This rap's a remedy. Here's your confession. Disclaimer, please see your GP or your PA or your NP. This is just for educational engagement and it's motivational. We're rolling with the meds. Don't you forget the names from A to Z. They're in this rap game. Indications on point. They light up the flame. Prescription to the rhythm. That's the name of the game. Esomeprazole, Nexium, the GI infection slayer. Helicobacter pylori, no longer a player. Estradiol, oral, S. For a woman's grace. Vasomotor issues or that atrophic embrace. Esopicion lunesta, for when it's time to dream. Insomnia's no match, we're a dynamic team. Attain your correct. Attain or set. Attain or set. Let's draw that out. Attain or set. Attain or set. Ambril, arousing in the mix. Ankylosing spondylitis. Get your fix. We're rolling with the meds. Don't you forget the names from A to Z. They're in this rap game. Indications on point, they light up the flame. Prescription to the rhythm, that's the name of the game. Ethinyl estradiol, an etonogestrel ring. Nuva rings the choice. Contraception on point, gotta drown the noise. Etodolaclodine, for that general pain. Release the aim, we ain't playing no game. Exenatide, beta-biduron, on the scene. Diabetes mellitus type 2, it's routine. Ezetimibe, Zetia, for that cholesterol high. Familial hypercholesterolemia, wave it goodbye. Familial hypercholesterolemia, wave it goodbye. We're rolling with the meds. Don't you forget the names. From A to Z, they're in this rap game. Indications on point, they light up the flame. Prescription to the rhythm, that's the name of the game. Famotidine, Pepsid for GERD, no more heartburn. Now you're living carefree. Famotidine, Pepsid for GERD, it's the key. No more heartburn. Now you're living carefree. For boxostapularic hyperuricemia's foe, not adequately treated, let that info flow. Felodipine, pendle hypertension's bane. Blood pressure in check, we're breaking the chain. Phenylfibrate Antara, phenylglides the call. Hypertriglyceridemia, we'll conquer it all. We're rolling with the meds. Don't you forget the names from A to Z. They're in this rap game. Indications on point, they light up the flame. Prescription to the rhythm, that's the name of the game. Fentanyl, oral and transdermal. Duragesic in style. Chronic pain's a struggle, but we're versatile. Fexofenadine, Allegra, for allergies that sting. Seasonal rhinitis, let freedom ring. Fentanyl, oral and transdermal. Duragesic in style. Chronic pains are struggle, but we're versatile. Fexofenadine, Allegra, for allergies that sting. Seasonal rhinitis, let freedom ring. Fidaxomicin, difficid, C. difficile's demise. We're on a mission, no more compromise. Finasteride, Proscar, propitious the end. Benign prostate hyperplasia, we transcend. Finasteride, Proscar, propitious the end. Benign prostatic hyperplasia, we transcend. We're rolling with the meds. Don't you forget the names from A to Z. They're in this rap game. Indications on point, they light up the flame. Prescription to the rhythm, that's the name of the game. So there you have it. A prescription rap spree. From A to Z, we've got the remedy. Remember, only for intellectual engagement and recreational. Please see your GP, NP, or PA or pharmacist, because these ideas are just motivational. Indications are clear, we set you free. Prescription to rhythm, that's the way to be. Indications are clear, we set you free. Prescription to the rhythm, that's the way to be.
Thanks for listening to the podcast series The New Student Pharmacist, where we discuss chemistry and pharmacy, as well as leaders in pharmacy careers, community, and chemistry and pharmacy research. We encourage you to support the work we are doing and follow us on Spotify and Apple Podcasts by subscribing for free. We are so glad that you were able to tune in today. Note, the views on the podcast represent those of my guest, and I take care and all the best.